Good afternoon, everyone. My name is Kalra, and I run the virtual care program portfolio at Infoway. One of the key programs in my portfolio is the Interoperability Enablement program. And I'm pleased to be providing you all an overview of that program. I always like to start with our organization's vision, which I am proud of and I firmly believe in. It is to ensure that all Canadians have equitable access to healthcare and their health info. And how do we do so? We do so by working with our jurisdictional partners and other stakeholders, collaborate with them to deliver pan-Canadian initiatives. And this program is an example of a similar collaboration. Before I dive into the programs in details, I want to talk a little bit about interoperability and what are the various levels at which organizations achieve interoperability. To me, the simplest definition of interoperability is ability to exchange data between various systems and ability to actually use that information in a meaningful, objective, consistent way. As you can see from going from bottom to top, the foundational structural and semantic level operability is achieved through various type of data transfer protocols, data exchange formats, and code set methodologies. But as you move up, you will see right on the top, you see organizational level, which is where the policies, the regulations, the legislations, they all come into the play to actually enable the lower levels. Okay, now let's talk about why is interoperability needed? Why everybody's talking about it? So there are three dimensions to it. First dimension, from a patient standpoint, interoperability is needed to support the delivery of safe, effective healthcare, especially during transitions of care. It provides the patient access to their data, easy access to the data from anywhere, as you would understand. The gaps in their information could actually lead to a negative implication when receiving healthcare. From a clinician standpoint, these delays and the lack of availability of connected data could actually result in loss of precious time and also causes burnout that we've often heard. Now, from a healthcare system standpoint, we have created significant value over the last few years into our system. Now it is the time to actually unlock that value and potentially realize the 3 billion of inefficiency, which is currently in our system. I want to spend a few seconds on this slide to share some of the stats that we captured as part of the international comparison versus our Canadian trend line. When we look at the percentage of primary care physicians who are able to electronically exchange a comprehensive patient clinical summary with the physicians outside their practice, which I touched upon in the previous slide, it is very relevant from a transition of care perspective. But you see, where do we actually stand compared to the international comparison? On the right side, you will see that, yes, there has been some positive encouragement and a positive progress in terms of moving from that 22% to 34%. Now, that 34% still may not reflect a comprehensive clinical summary for a patient. So this is a nice segue into the next section about the program. Infoway, we undertook this new interoperability program last year to support the provinces and territories by facilitating national collaborative effort to advance interoperability in two priority areas. First area being the definition of patient summary and be able to exchange the patient summary in a clinical setting, which supports the transition of care. And the second one is secure messaging exchange across solutions. There are solutions in the system today that offer secure messaging capabilities, but they're mostly operating in silos. So our goal is to build implementable specifications that actually support the exchange of cross exchange of message. And in doing so, we're not going to start from scratch. We're going to look at some of the international standards that are already working well for our international counterparts. This includes the new fire exchange standards, leveraging the established testing practices from IHE, and also leveraging the international patient summary standards, which, as a matter of fact, Canada also signed to support at G7 in 2021. I will walk you through the key components of the program that we established last year, and we continue to progress on that front. The first and foremost is the collaborative governance. This we established with some of the leading jurisdictions, BC, Alberta, Ontario, Saskatchewan, and Newfoundland, who are actually committed to delivering this and have put this program on their roadmap. The second key component of this program is vendor management. Vendors are critical to the success of the program, as they'll have to make changes to their product to ensure that the implementable specs that we are delivering from a pan-Canadian standpoint are properly implemented into their system. And we will be ensuring that a common testing infrastructure is set up to support the testing of those implementable specs across those multiple vendors and jurisdictions, which is the value that as an organization we bring to the table. Trust framework, the third piece, very critical, where we will be working closely with the policy working groups within the jurisdictions and collaborate and consolidate the requirements to better understand what the data sharing needs are, what are the consent requirements, what are some of the PIs and the TRs that we need to do in order to enable these programs. Next component, pan-Canadian work product. It is very important, this work that we do, the work products that we deliver, they are truly at a pan-Canadian level. This saves the jurisdictions, releasing their own versions, and it also lessens the impact on the vendors who have to actually do things multiple times, versus now they'll have to do it once because these are pan-Canadian. Next component around common processes. It is extremely important that we build the processes to easily onboard the new jurisdictions. Right up front, we have 5 leading jurisdictions who are participating, but we expect other jurisdictions to come on board as well. Similarly, new vendors. We're working with few set of vendors now, but there will be an appetite to onboard additional vendors. So we're going to simplify the onboarding processes for the new stakeholders to actually come on board. Collaboration platform. When you are in a multiple complex stakeholder setting, a common collaboration platform or a space is extremely important. And this is the space we use to publish our specifications, to seek feedback from our stakeholders, incorporate that feedback, and finally take it to a finalized state. So that's where we have the collaboration platform. Finally, last but not the least, the standards and the maintenance. The selection of the standards in a truly collaboration manner. Once the standards are delivered, the specifications are delivered, there is a responsibility to maintain, sustain those standards from an ongoing changes perspective. So this is where our team, as part of the NRC, who has been actually doing this for many years, will continue to do that, and we're ramping up that team. I want to spend a few minutes and zoom into one of the specific projects. I talked about the 2 priority areas, but I want to focus on one of the area, which is the patient summary. So when we consulted our jurisdictional partners, clinicians, patients, and other industry stakeholders last year, everybody identified patient summary as the top interoperability area. And this is how we actually landed on working on this as a focus area. As you would understand, when the clinicians have to reconstruct their patient histories for every encounter, it takes considerable time and effort away from them. And it's one of the reasons that causes burnout amongst them. So the consolidation of multiple data sources for patient summary actually could improve the workflow efficiency, and it could provide better care of patients. Availability of good patient summary has several benefits. It provides greater health outcomes, certainly provides better patient safety, improves the provider and patient experience, creates the ability to exchange patient flows cross-jurisdictionally, which is going up the maturity curve, and you need policies to actually support that. From a clinical standpoint, it avoids medical emergencies, support a scenario when there is unfamiliar provider at the point of care, and the right amount of information is available for treatment, and of course, better coordination of care. In one of my initial slides, I talked about leveraging the international standards, and specifically international patient summary, to define the building blocks and the interfaces that we will configure to support the necessary jurisdictional variances. As you would appreciate, every jurisdiction has some sort of variances, but the idea is to find a consolidated view and find a path to deal with those variances. This is a pragmatic approach we collaboratively as a team has taken. To start from top, we're going to look at local release, which will focus on exchange of information in a local jurisdictional manner. And as we start to go down, from provincial to cross-provincial and international level, this is where the other technology components will play a critical role, but most importantly, some of the policy work, consent, and those trust framework will start to come into play, because now you're talking sharing a patient data across the borders. So this is an approach that we're taking, and this is something that has been tried and tested in other countries as well. So we're following the best practices. I want to draw a distinction between the two key deliverables that will come out of this initiative. One being the Pan-Canadian initiative, which is focused on the patient summary for the Canadian context, leveraging the IPS principles. The other being the overall interoperability reference architecture, which is a program-specific deliverable. It's important, actually, we deliver something, which is in front of us when it comes to patient summary, but at the same time, establish the program in a way that will able to actually take on more use cases and more priority areas using the foundational blocks that we will build. An example, when you look at a Pan-Canadian interoperable reference architecture, we would need to work closely, with our jurisdictional partners, with our vendors, to understand the other program components. Example, identity, authentication, consent, and some of the other privacy requirements. So we'll continue to progress on this as it's a long-term journey. It's not just one release. How do we work in a collaborative manner? It's important to know what role Infoway is playing as an organization. And we act as a facilitator by leading, convening various complex stakeholders, multiple stakeholders. We bring them together in the ecosystem, and we deliver a common consolidated Pan-Canadian work. Now we start with patient summary, and this work will continue with other use cases. We'll play a critical role in mobilizing the solution vendors who are critical to the success of any of the interoperability initiatives. We will be consolidating, curating, and coordinating and building those reference materials in our central library, which will be made available not only to the participating stakeholders, but also the other stakeholders who are planning to join and participate in this program. And finally, I did talk about in the last slide, building a common testing platform based on international practices, based on using industry best tools, which will support both the public and private implementers to conduct projectathons and support the prototyping exercises as we actually deliver the next releases. And I do have a slide on Projectathon coming up, and I'll touch upon that a little bit more on that. Quickly want to actually give you a view on what is our engagement approach and the roadmap approach, as the deliverables that we mentioned in the previous slide will be published to external audiences at specific points in time as we progress in the life cycle of the program. As you would see, we have built an elaborate iterative approach in getting to the end product because we do believe that it would require a few iterations before we get to an implementable Pan-Canadian unanimous specification. As we go, you could see there are multiple cycles of reviews, iterations that were built in right from the start. After we publish, taking time to seek feedback, refine it, publish it again, and then get it to a Projectathon event, which we're targeting sometime in February, which is where we'll have some of the participating vendors and jurisdictions come and test out the specifications that we're building. And then that would give us an opportunity to further refine it and take it to the first release work. At present, as you could see, this is set out for the next 5 to 6 months with the Projectathon plan for February and broad communication around releasing those specifications by May, June, which the PTs and the vendors will be able to fully implement. And that will be the next step to actually take it to the production. Projectathon. So what is that event? So since I talked about it, so I want to spend a few seconds on that one. Projectathon, the event that we're taking in February, it is similar to hands-on testing event. As you know, Fire, North, and some of the other international Projectathon events that happen. In this event, we'll be collecting feedback from the implementers with a goal to improve our patient summary specification. The stakeholders who will be participating will be focusing on a set of actors and transactions which were already defined in the first release of our patient summary specification. We expect the event will last for a few days. It is expected in February next year. We will be publishing the specific dates shortly. What are some of the minimum requirements? We are targeting at least one EMR, one HIS system, and at least one PTs. Of course, we're going to target more than that, but that's the minimum requirement to conduct this Projectathon or connectivity event. Now, what this is not is a conformance testing of the solution against the specification, and it will not lead to a production grade solution, as there will be further refinement after that. As I had stated, this is the start of the journey I used in the slide before. I tried to depict a high-level roadmap of how the two initiatives will progress over the coming years. As you could see on the left, we will be working collaboratively with our stakeholders, the jurisdictional partners, the industries, the PCHOs, High, to develop a long-term interoperability roadmap, which will clearly spell out all the deliverables, the milestones, and the outcomes we'll accomplish as we will go. It will be published sometime next year, mid of next year, the detailed roadmap. From an accomplishment perspective, our team so far has established a great pan-Canadian collaborative governance, which I talked about from the participating jurisdictions. Our scope for first release, which we call MVP1, is finalized. The team has already completed the use cases and requirements. The current implementable specs are in a draft review mode. And finally, the data dictionary and the data set for MVP1 has been completed. And with that, I would like to conclude my presentation and open up the floor and ready to take any questions. Thank you.